Good morning. This is Faith in Our Hometown, brought to you as a community service and sponsored by Mercy Hospital, Joplin. And now, here's your host, Father Jay Friedel.
Good morning. Thanks again for joining us for Faith in Our Hometown. Our conversation about faith and the things that affect our lives as members of the greater Joplin community. And so, welcome back, I hope. And our guest this morning is going to be Lisa Nelson. Lisa works in a very interesting position out at Mercy Hospital in what is known as the Sisters Health Boutique. And that is part of their ways that they care for special people who are dealing with cancer, and especially those dealing with breast cancer. So we're going to be back in a few moments to talk with Lisa about what she does and what their part of the healing ministry is all about there at Sisters Boutique. Because I think that there's some fascinating things that they're doing that sometimes people like me wouldn't normally think about, but they're very important to the lives of other people. So we'll be right back after this Mercy Minute. Thanks for joining us this morning, and don't go away.
Find out how a Mercy doctor can take care of you. At Mercy, your life is our life's work. Quality, safety, and an exceptional patient experience. Mercy is grateful to be recognized as one of the top 15 health systems in the United States. At Mercy, your life is our life's work.
So welcome back. Again, my guest this morning is Lisa Nelson. Welcome, Lisa.
Thank you.
Lisa works at Sisters Health Boutique there at Mercy Hospital. So why don't you just tell us a little bit about yourself, and then let's talk a little bit about what you do at Sisters Health Boutique.
Okay. Well, I became a certified mastectomy fitter about 10 years ago, much to my surprise. I had been a business owner, cosmetologist, and esthetician for 20 years and kind of had burnout. But I loved the part of my job I loved the most was making someone feel really good about themselves. Mm-hmm. So I had an opportunity to sell my business, and a young lady at church said that I was the missing element that they needed. So one thing kind of led to another.
Be careful when they say things like they do at church. But
there you go. That's right. And it's just one of those things that I feel like a door opened, and I had a wonderful opportunity to step through that door. So when I first started to do what I do now, I had no idea really what I was getting into. But it's been a wonderful experience. I have grown to meet a lot of really unique people. Made a lot of friends with our patients because in the type of job that I do, when you actually touch someone physically, there's a bond there, and when they see that you really care about them, it makes a big difference.
Right.
So what I do as a fitter, when a patient has been diagnosed with breast cancer, really any type of cancer, and you hear that word, you kind of shut down a little bit.
Oh yeah.
You know,
nobody. I mean, it's just like,
this doesn't happen to me.
Right.
This hasn't been in our family, but that's kind of a farce anymore. It's not always just about the fact that whether it's in your family or not, it can happen to anyone.
Right.
And we've all been touched by it, whether it be breast cancer or some type of cancer. We all know someone.
Right.
So when someone has been diagnosed, we work closely with our nurse navigator, Rita Glaze. She's a pretty unique lady too. She's there as soon as the patient is found positive to have breast cancer. So she starts leading them through their journey at that point, and we are part of that journey. At Sisters, what we do is the patient they suggest that the patient comes to see us, and we will sit down and chat with them about their post-surgical garment, which is a garment that helps them with some compression after the surgery to help with drainage.
Okay.
It helps with drain tubes, that type of thing. And really, the main thing that they're thinking is it's going to help them to get back to a normal life, maybe a little quicker, back to work a little bit quicker, and get back into their routine. So they come into our store and we just take a little bit of information, and then we have a beautiful consultation room. So what's so neat about that is you don't feel like you're in a medical facility at all. Our store has such a nice ambiance to it. We hope that we treat everybody with very welcome arms when they come in. They're very special people to us. And we just sit down with them and start to visit with them and the family member. We always encourage a family member or whoever is with them at the time to come in and sit down and be a part of that.
Okay, so this boutique, this little store, in effect, is there at Mercy and on the premises, but it's kind of like this little world within it.
It is.
It's kind of like you step out of the hospital, even though you're still in the hospital.
Right.
And you get the opportunity to visit with them about what their post-surgical or needs are going to be, and you get a chance to engage them at that level.
Absolutely.
Okay.
And at that point, that is when they still, there's a lot of gray area there for them. You know, your doctor's there to share with you about getting you through this. But as a woman, I realize my main concern is how is this going to look to me? How am I going to get, is everyone going to know what I'm going through, and how am I going to feel about this? So we listen a lot. You can learn so much from people just by sitting back and listening and just being concerned about that person. And we go through with them. At this point, there's a lot of decisions that these ladies have to make. It's their decision whether they, once they have their mastectomy or lumpectomy or whatever type breast conservation surgery or whatever that they might have, what their doctor feels is important, and then they make the final decision. And whether at that point it's going to be good for them to go through plastic surgery and have reconstruction, there's a lot for them to take in.
Oh gosh, I'm sitting here, my head's spinning, so I can imagine once you hear a diagnosis, first of all, cancer, and then all that, then you get all the medical stuff. But, you're there to provide in some ways another, just kind of a human, less medical, more human touch to do some of those things. And so as my head's spinning, I can imagine their heads are spinning as they have to make all these choices.
Right.
Yeah.
And you want to be there to be concerned and show them that you are there for them. But we're not there for true medical advice to them.
Right. I mean, that's what the doctors are for.
That's
but you're
right.
helping in a different way. It's a different kind of. It's a different kind of healing, if you will.
Yes, it is.
Yeah.
And it's just another layer to our breast center and our cancer center that makes it special.
Okay.
Yeah, and we go over with them and just to give them the information it's going to take for them to help make their decision whether reconstruction or prosthesis is better for them, for their lifestyle, for how many surgeries. But what we try to do to them is just show them what is out there, because you know what we have found when a lady comes in to us, and if they don't know a lot about what the surgery is going to be all about, or what we're talking about, a prosthesis and this and that, they think we're talking a big surgical garment. We're thinking something that everybody is going to realize that they have. It's going to be something that's going, that maybe you have to dress differently, or it's going to change their activity level. And we're there to show them it doesn't have to. You can, if you're a swimmer, you can still swim, and we have prosthetics that are for that. We have swimwear that is pocketed. It's very helpful to them. We have different types. It's almost like a wardrobe of prosthetics and garments for our ladies. Cancer doesn't have an age limit or base anymore.
Right. Yeah.
I find that a lot of our patients are getting younger and younger. not sure what all the statistics show about that, but we have a lot of younger women that.
I think that's, I mean, again, I probably, I may be asking you something you don't know, but do you think that's because we're getting better at detecting things earlier or just treating things earlier? I mean, what's your sense?
Well, I think the awareness has made a huge difference. Women are so aware to do their self-breast exams and to be aware that it can happen to them. And the fact now all the genetic testing that is out there to see if, someone is a carrier of the gene, if it is something that has been going, that has been some per se handed down into their family.
Sure.
It's very important. And we find that there have been a lot of women, young women, that when they're expecting is when they find out that they have breast cancer. So the devastation there is tremendous.
Wow, yeah.
The happiest time of your life can turn into something that's not so happy.
Right, challenging.
It's challenging, but there are so many treatments out there now that they can even do while she is expecting. So we're not just there for that side of it, but one thing that we have truly noticed, and being a hairdresser previously, the hair loss.
Oh, yeah.
There are a lot of people, a lot of ladies that they don't think that's going to be a big deal. They're concerned about their surgery, and they're concerned about, am I going to have chemo, and am I going to have radiation and doing all these things. And then all of a sudden they say, you're probably going to lose your hair, and when the doctor says you're going to lose your hair probably on that second treatment or in 2 weeks, it's pretty much to the date. And I think it would be in my head to think, I'm going to lose some hair. There's going to be a little extra hair in the sink, maybe on my pillow. But when you can reach on your head and you can run your hands through your hair and you get a tremendous amount, that's devastating. When you get up and it's on your pillow, when you come out of the shower and it's all over the place, that's devastating. So suggestion to women when they tell you that, it's so much better to try to address that with a friend or a family member. And before you start that, come and see us and let's look at some wigs. We have an American Cancer Society room in our store that we have wigs that are actually donated or given to us through the American Cancer Society. They're brand new wigs. And through grants and such. You hear of Relay for Life through American Cancer Society. That's one of the fundraisers, and the monies goes to that for the free wigs for ladies.
Yeah.
So it's a private room. We close the door. We help to pick out a color to match, if you want it to match your existing hair, your style. And what's amazing to me? It's like we may not have maybe 12 wigs, but it seems like we always find the perfect one.
Well, that's, I hear what you're saying, and I can resonate with it on an emotional level. But one of the things that is so true is that guys, when it comes to how to be supportive in these ways, are just typically pretty. I'm going to use a technical term, not a value-ridden, but we're ignorant. Okay? Not because we want to be. It's just that we don't know a lot of these things. And so it's really important for me to be talking to you and for so many of our listeners to be hearing these things because, again, we don't necessarily know how to be as supportive as we would be otherwise. And for you to bring some of these things up for us, it becomes, pretty important for us to be able to have the conversation and be more comfortable and to be able to raise some of those issues with the women that we know that are going through those things. So I'm finding the conversation, again, just some good reminders for myself of some of the things that I need to keep in mind. We are discussing with Lisa Nelson from Sisters Health Boutique at Mercy what we can do to support our sisters who are dealing with cancer. This is Faith in Our Hometown. We're going to be right back. Don't go away.
You're watching Faith in Our Hometown on KSN TV, brought to you as a community service and sponsored by Mercy Hospital, Joplin. Well,
welcome back again to Faith in Our Hometown. Again, our guest this morning, Lisa Nelson, who works at Sisters Health Boutique at Mercy, a special little unit there, part of the cancer treatment team, for helping women who are experiencing the challenges that come along with that. We've talked a little bit about fittings for mastectomies. We've talked a little bit about wigs and those kinds of things. Next week, next week really, we're at the end of September here, so October, Cancer Awareness Month.
Absolutely.
Okay, so this is very timely that you're on. Again, we're raising our awareness, because that's what you're doing for me, is kind of just tweaking my awareness a little bit to make myself and the male part of the culture a little bit more aware of some of those things that are going on, and I think that's really important. You're in a position where you help women all the time who are dealing with these things. What would be your best advice if we wind up with a friend or a family member or somebody who winds up with cancer? What are some of the other things we can do to assist them and to help them as we go forward?
One thing that seems to be that comes to mind the most for me is don't ignore your friend. Don't ignore the fact that this is happening to her. I have patients all the time that'll say, why is this happening? I don't get this. How could this be happening to me? And what I have found is that person, I always tell them, there's going to be somebody that's going to come through and walk through your life, whether it be at your church or at your work or in your neighborhood, a friend or someone that's going to need you to help walk them through this too. And I find that happens so often. They'll come back in, they'll be like, you're right, my neighbor just got diagnosed.
Right.
So to me, if it happened to me, I would just want my friends, my family, just to say, you know what, I'm here, and I'm here to listen. And I would really want them also to say, when you're ready, let me go with you. I would like to help you pick out your wig. Or I would let's go look for some headscarves today. Or, just to try to help them through that instead of, hey, I found this website about breast cancer. Stay away from most of those.
You mean not everything on the internet's true?
That's what I've heard.
Oh, well, there you go.
So, it's just
true.
better if, there are great sites, and once again, your doctors, your navigators, they can give you good knowledge.
Right.
And that can help your family too.
But that's not what people need from a friend. They got the doctor to be the doctor.
That's right.
They've got the nurse to be the nurse. But I think that friendship thing, I will tell you, one of my friends, was dealing with, some issues with cancer and then some other illness that came along because of the cancer, because of lymph, the drainage system and all that kind of good stuff, and having another surgery and all kinds of complications, all kinds of problems. And as a result, her hair really started to thin a lot.
Yeah.
And so one of the blessings that we had was we were all of us together out, taking a trip together. The tribe was going on, a trip together. And one of the things we just did was that at that point in time, she just said, what I'd like to do today? I'd like to go look for wigs. And I'd like you guys to go with me. Well, we just like, sure, if you want us to go along, we'll go along.
Right.
What the heck? And so there we were, 3 guys, 4 women, and we were all out together in this store in Las Vegas, of all places.
Wow.
We're out there, we're doing our thing. And we went, and it was a great wig shop. We went and looked we found, she found the perfect wig. And we all knew it the minute that she put it on her head.
Right.
And it was just, we all felt good that we could be part of her feeling more normal again.
Yes.
That was a healing moment. Now, trust me, I have no expertise in wigs. I have no expertise in cancer and cancer treatment, all the different things that she went through. But what she needed me to be was the friend. And that was something, again, we could fulfill that role for her just in terms of being there in a support position to do that.
Right.
So extremely important.
It is.
And, and letting our listeners know the same thing. We don't have to be the cancer experts. No. We don't have to be the prosthetic experts.
No.
We don't have to do any of that stuff. There are people around who can do some of those things. But the friendship part is really, really essential, I think. And sometimes we forget the importance of the human touch, the human connection.
That's right.
That we can be for our friends, because we're their friends, and we can do those jobs that nobody else can do for them.
That's right.
In that regard.
It's so funny to me when the patient comes in and they're looking at the wigs, and we may pick out 2 or 3 and they try on, and it seems like it's, you'll pick out, and usually it's the first one that you first try on. It seems funny like that. We may try on 6 or 8 or whatever we end up trying on, but they seem to go back to that one. But what's, with the wigs now, most of the wigs that we carry in the store, what we found is with the American Cancer Society, if we didn't have exactly what that patient needed, we realized that we needed to carry some wigs that we could also sell to our patients, because they were going to be that need. Unfortunately, most insurance companies do not cover wigs. They consider that cosmetic and not a medical necessity. We do have wigs also for sale in the store, and if we don't have what we need there, we can special order and have it just in a couple of days. So that's another thing is when you're a friend or whoever, it's like, do you have a certain time amount before, if you're going to lose your hair, do you have a certain time amount before that happens? Have you thought about maybe we should go do that before you do? There's a lot of patients that I've seen that are a little bit in denial of the hair loss. They don't think it's going to happen to them. Right. Or maybe it's just going to thin and maybe this or that. And, that, once again, as a support, might be to say, maybe we should get some headscarves. Let's get some turbans. Maybe we should just go look, And if it be at that point that she feels comfortable with that.
Right.
I have had people come in before. I think probably the most touched I was when a husband and wife came in, and she was getting ready to. She had ordered her wig, or I can't remember if she ordered or if she just came in to pick one out, and she was a coworker. And sweet lady, and I had worked with her from the time that she got out of the hospital. Did not know about her post-surgical garment and came to me on the way home, mind you, and stopped, and we got her taken care of with that and that need. But then when she started to lose her hair, her husband came in with her, and he had already made her appointment. He was on the phone while we were picking out the wig with her hairdresser, so she could go and get the rest of her hair shaved, because it was just coming out everywhere.
Sure.
And that appointment needed to be prior to their time getting ready to go to chemo too. So he was making that appointment for her, and I just thought that was probably one of the most special things that a husband or a friend could do. Yeah. Because it meant so much to him for her to feel normal and comfortable about herself. And she just looked so pretty because she knew that he was concerned. We got her wig, we got her fixed up. We fit her with the wig. Then she came back after she had her head shaved, and we trimmed it up a little bit for her, so it would be just perfect for her. Yeah. So that was a great experience for me. I mean, to be a part, I feel like I became a part of their family at that point, because it was just, such a sweet time to be with them. And it can be a very emotional time. Sometimes when they come in and they feel they're ready to try that wig on, and the first one you put on, it really brings that reality to face. They're looking in the mirror at themselves. They see this kind of a different person, the changes that are happening due to the treatment. Right. And I've shared tears with them before because it's very hard for them, to see that part of the change, thinking, how did I get to this point? And, once again, you just kind of have to, those tears sometimes can be very healing to them. They've got, that they have to get that out. Yeah. And, they might be in a situation where they don't have that type of support from someone else. And to be a part of that is special to us, that we can help them with that. And my coworker, Crystal, and I both have cosmetology background, so we can help with that part for them. One thing too, I always, the patients will tell me, it's so strange. It's like my hair hurts when it starts to fall out. And it is, your scalp gets very sensitive as your hair starts to come out due to cancer treatment.
All the people I've ever worked with, nobody's ever told me that. And so that's why I'm saying, again, these are fascinating conversations for me, because I never,
Right.
I just never, nobody's told me that before.
Well, I learned that from a patient that came in. Your doctor's so concerned about your health and getting you better.
Right.
And so if I can learn more from my patients to share with another one, to me that's very important.
Sure.
One lady said that she sleeps with a fan on at night. She said even to have the fan blowing on my hair before we shaved it off and buzzed it off, it hurt.
It hurt. Wow.
So I can't imagine what that would feel like.
Well, I mean, I know when when I've got the flu, okay?
Sure.
I know that I'm sick when my hair hurts. So all my hair follicles hurt.
That's
true.
And
I've been there. I mean, I know that, but I sure don't know it from that angle. And I never would have considered that from that kind of thing.
Right.
Well, I got to say, Lisa, I mean, again, I appreciate the work that you do, at Mercy. I appreciate as I'm sure all the patients who work with you do in doing something like Sisters Health Boutique. Again, it's a human piece of the cancer treatment. It's a human piece of healing that sometimes, we wouldn't connect with all the medical stuff and the chemo and the radiation and all those things. But as somebody's going through a challenge of cancer in their lives, this is one of those human pieces that I'm glad you and people like you, your coworkers and other people who do them in other institutions, are there to do some of those things. We're going to be right back after this Mercy Minute. You're with Faith in Our Hometown. Stay tuned, don't go away. We'll be right back to wrap up.
I think it's important to see the plastic surgeon beforehand, so that way you know what the options are in terms of reconstruction, whether it's one breast or both breasts, or whether if they opt for what's called conservative therapy, if you have a lumpectomy and radiation, what are your options after that? So I think it just empowers women to have more information to decide what's the best decision for them moving forward. And some of the pluses about immediate reconstruction are that you, for the most part, have one less surgery, and also psychologically, a lot of women just love knowing that they've already started the healing process.
Well, thank you for joining us again this morning for Faith in Our Hometown. Our guest has been Lisa Nelson, who works at Sisters Health Boutique at Mercy Hospital, part of the non-medical but very healing ministry that's a part of their cancer team in the way that they tend to their patients. One of the things that I want to make sure that we mention is that October 14th begins the Pink and Pearls event for Mercy. And if anybody's interested in it, it's education for breast and lung cancer. Okay, and so if anyone is interested in learning more about that or signing up for it, mercy.net, okay, mercy.net, you can sign up to do those things. But the really important thing that we learned this morning is that being a friend is extremely important to anyone who's suffering from going through something like this, so that we need to do the best that we can to do that. Thanks again for joining us for Faith in Our Hometown. Come back next week.
Thanks for watching. Faith in Our Hometown can be seen Sunday mornings at 6:30 and 9 a.m. on KSN. Brought to you as a community service and sponsored by Mercy Hospital, Joplin.